So the last topic for today is fecal transplantation, definition, indications, and various delivery methods. So fecal microbiota transfer and implantation of the stool and bacteria from the colon of a healthy person to a colon of a person with a certain disease to affect the cure of that disease. So what are the indications? Recurrence more than 3 times of mild to moderate C. diff infection, failure to respond to standard therapy, more than 2 episodes of C. diff infection resulting in hospitalization and significant. So if you have recurrent C. diff infection, mild to moderate C. diff, more than 2 episodes resulting in hospitalization, that is severe, almost significant morbidity, moderate C. diff with no response to standard therapy for at least 1 week. Severe C. diff, no response to standard therapy after 48 hours. So these are the specific indications for FMT. So what are the other indications other than C. diff? So we have seen these 4 indications for C. diff, and other indications would be inflammatory bowel disease, irritable bowel syndrome, metabolic syndrome, fatty liver disease, multi-resistant organism eradication, hepatic encephalopathy. So all these conditions, it is tried. Okay. So the mechanism is that fecal microbiota transplant restores the microbiota of the intestine by installation of donor stool into the gastrointestinal tract. So this procedure has a good clinical, normally it has a good clinical response to refractory and recurrent C. diff. So the evidence comes from the systemic review that was published in 2011 for recurrent C. diff infection. And clinical resolution was found in 92% of the patients without any significant side effects. So how is it being done? First is donor selection, screening of the donor, then preparation of the stool and administration. So these are the 4 steps. So first, donor selection. The donor family members, intimate, the patient who's receiving should be, the donor should be either a family member or an intimate friend above the age of 18. And certain diseases are common in women, so men are preferred over women. And pre-screening of the donor. And donor screening involves, so we'll look at this in detail. Donor screening involves similar to blood product donation. So usually screen for certain diseases to make sure the person is healthy. So what are the infections that are screened? Hepatitis A, B, C, HIV, H. pylori, syphilis, C. diff, Giardia, E. coli, Salmonella, Shigella, Campylobacter infections. So these are the usual screening. Stool preparation. So how is it being prepared? Ideally, the stool is collected from the donor and processed in 250 ml of water. Okay, if the large particles are filtered, and it can be frozen and kept for future use. So administration, it can be done either as oral capsules, retention enemas, colonoscopy, and nasojejunal tube placement, and small bowel upper endoscopy to the jejunum, and it can be transplanted to the jejunum. So these are the various criteria and the lab tests that should be done for the donor. So the potential exclusion criteria for the donors include age less than 18, obese person, more than BMI more than 30, person who has a metabolic syndrome, more undernourished person donor who has a diarrhea within the last 3 to 6 months, history of C. diff infection, immunosuppressive agents, a history of drug use or recent risk factor to HIV or viral hepatitis, history of travel to tropical regions, irritable bowel syndrome or disease, or gastrointestinal malignancy, major surgery, any autoimmune or atopic illness, chronic pain syndrome, so any neurological, neurodevelopmental disorders, malignancy. So these are the specific criteria, and also history of antibiotic use in the last 6 months. So this is also something that is one of the criteria for exclusion. So what are the lab tests? So they screen for bacteria, viruses, parasites, and others. So bacteria include Salmonella, Shigella, Campylobacter, H. pylori, VRE infections. Viruses, all hepatitis, HIV infections. Parasites, strongyloids, amoeba, microsporidia, geodia, cryptosporidium. So all isosporas, cyclospora, all those which can cause diarrhea. Just remember like that. And C. diff infections also. Okay, these are the specific screening tests. So how is it being administered? So either as pill or liquid form, that is something. So once the good bacteria is processed, it is made into either pill or liquid, either through the either through nasoenteric tube. So the advantages and disadvantages of every method is being given here. So upper endoscopy can be done relatively. This is also a procedure. Capsule, very easy to administer. Colonoscopy, procedure related risk, additional cost. Sigmoidoscopy, same. Retention enema. So these are the six methods wherein it can be administered. So efficacy, when we look into the safety and efficacy, the risk of on the short term basis, risk of aspiration, if not delivered deep into the small intestine. So that is there. Risk of acquiring infection from the donors, but if it adequately screened, the risk of infections is rare. Procedure related complications, bleeding, perforation, transmission of other infections other than whatever is screened is less than 1 in 1,000 to 1 in 10,000. Long term, it is something that involves a complex interplay between the gut microbiome and the host. So the conditions of the donor play a role. So intestinal microbiota has been associated with colon cancer, diabetes, obesity, and other atopic disorders as well. So we come to the end of this session.